when you go out into the community and you ask individuals, and when you look at the research, everybody has an idea about why is this happening. Is it drugs? Is it alcohol? Is it because African American women aren't making their prenatal visits? Is it because they have more domestic abuse in the home? Is it because they don't have as much education? Is it because, what is it? Is it environmental factors? What is it? Well, after digging back all of the layers, even if you look at all of the different variables of not educated or not making prenatal visits, side by side, African American women are still losing their babies at a higher rate, even if it's the same demographic or variables of a Caucasian woman. Side by side, African American women are losing their babies at a higher rate, no matter what the variable is. So that's concerning, which had us look more into the research of what's happening with medical providers, what's happening, are they not catching different diseases and things like that sooner? Upon talking to the public health department and the epidemiologist and looking at the different research, what it's really showing us is that healthcare providers aren't catching things early enough. It could be because of prenatal visits. But again, even if a Caucasian woman is making her prenatal visits or not, their babies aren't dying, but ours are. There's a very interesting area of research that is now talking about weathering. That's the stress of a mom, right? So I'm sure you all have heard that. It's the overall stress of life cycles and lifetime, different stressors that have happened within her life and how that's been treated. And then on top of that, how medical professionals are approaching this mom. Out of 1,000 births, if 11 of our African American babies are dying and only 5 of a Caucasian woman's babies are dying, something is wrong there, right? The disparity is so great. So at looking at these variables, what is it? Think about in your mind, what do you all think that it is? What have you heard? Race. Okay. What have you heard?
I would say it's medicine.
The medicine?
Medicine that they inject into the poor community without knowing. Because it's a lot of things that they induce in our community that helps heal, you know what I'm saying? The ICU, the birth control thing,
Yeah.
but you had side effects that cause birth problems.
Yeah.
With that,
I'm glad that you said that because African American women at a higher rate are pushed into the C-section. And why is that? Right?
It's genocide.
More money.
You
Education.
could say that. Education. The interesting thing is that we're not all treated the same. We're not all treated the same. And it's okay to say that because that's the starting point. We're not all treated the same. There's been research, David and Collins in 2017 did a study on looking at different healthcare administrators saying, what's the difference here? There are some ideas that African American skin is thicker. We're talking about 2017 research. The medication, it doesn't take well with their body. If they're treated for certain things, they may not be able to have a healthy delivery, so we're going to take this to mean that they need a C-section, or that we need to go ahead and speed up the delivery. There's just different biases based on our stereotypes, based on the division that we have in our country as a whole, that really need to be dispelled. And we got to start by talking about it. We are already very familiar with the statistics, and they're going to talk more about the specific statistics here in Smith County. But on a healthcare and administrator level, my goal is to continue to let the voice be heard through research, where practitioners are reading these medical journals. Healthcare providers are wondering what's the next steps. And there's so much research there that is pinpoints, one reason, an environmental reason, or not making prenatal visits, or not being able to, or having domestic abuse in the home, or not having enough education. But collaboratively, when we look at this all together, there's a lot of different variables that are impacting the community. And so It starts here though. It starts in our own biases in our own mind, because we do take it and we spread it. Well, it's probably because the medication that they're giving. But they're giving the same medication to Caucasian babies too, and these babies aren't dying. So what is it? What else is it? What's going on? It's a question that's there that needs to be addressed. There are individuals on the ground who are, promoting the ideas of doulas even more, because what we recognize is that when a woman does have a doula, another advocate, someone there with them, that they're treated better. As a woman is going through the birthing process, there's so much going through their mind, the stress of it all. They don't have time to address this attitude, this poor attitude of this practitioner, or the dismissive behavior of that practitioner. But the doula is there to make sure that everything stays in place with that too, and make sure that they're treated well. Asking questions that the mom might not think to ask in that moment. So it's really a great addition to the medical field. We really, really need them.